Hi, everyone. This is another episode of Candid Conversations, and I have the beautiful honor of having my friend here today, and just really an incredible human, an incredible doctor, dentist, doctor, just teaches me so many things. Okay, guys, let me let you in on a secret. For first of all, I'm Dr. Funke Afolabi-Brown. I'm the founder of Restful Sleep MD and the Restful Sleep Place. Literally, as we were getting on here, okay, I'm like TMJ, and she just looks at, she gives me this look, and it turns out it's a pet peeve of her. You don't say TMJ. What is TMJ? TMJ is a joint, right? I'm learning that. So today we're going to be talking about oral health, but then I think just really demystifying some of the things that even I am not very clear on. I work with a lot of dentists, and honestly, before I got into this field, I thought dentists were dentists were dentists were dentists, but it turns out that all kinds of dentists. So we're gonna get like really a deep dive into who you should be seeing, the dentist that tells you to floss your teeth versus the person you're supposed to see when things go wrong, right? And so I just really am so excited to have Dr. Idahosa here today. And so I'm going to have you introduce yourself. She is a dentist and then some. So for you guys that are joining on live, please just say hi, wave, do something. If you're coming on a replay, hit hashtag replay. I would really, really, really love for you to lean in because we're going to learn so much today. So very, very nice to see you, Dr. Idahosa. By the way, we live 15 minutes away, so apart
Okay.
from each other.
We live 8 minutes away.
Oh, you would know. All right, let's start with you introducing us yourself.
Okay, hi, I'm Dr. Idahosa, Chizobam Idahosa. As Funke said, I'm a dentist. I'm a dentist specialized in oral medicine, orofacial pain, and lifestyle medicine. So I see patients at a private practice in Lansdale, PA, and I also teach part-time at a dental school. So that's just a very short summary, amongst other hats that I wear. I'm a mom, I'm a wife, other things. But for today, I'm a dentist specialized in oral medicine or official pain.
Okay, so I'm just gonna tell you people something today. She is not just a dentist; she's a triple board certified. Okay, so I'm a triple board certified doctor too, right? So yes, I get it, but this is a huge deal. She's on the next level, like several levels up. This woman has, she's at Penn, she's worked in Temple, she's been like all over, has done so much, and I just want to blow your trumpet. You are making strides. You've done so much. You're such an inspiration. So, but let's start. Let's even start from the beginning. This, what is oral medicine?
You froze. So I'm going to take your question. I believe you were asking, what is oral medicine before you
Yeah.
unfreeze?
Yes. Who is an oral medicine specialist versus orofacial pain specialist versus just a general dentist, not just a general dentist.
Okay. So, like you mentioned, I'm board certified in oral medicine, orofacial pain, and lifestyle medicine. So, we'll start with oral medicine. Oral medicine is a specialty in dentistry that focuses on the prevention, evaluation, and treatment of medically related disorders that affect the oral and maxillofacial region. Basically, non-surgical management of medically related disorders. So when I say medically related disorders, I'm talking about conditions that have a medical background. That means things like lesions, oral lesions, like aphthous ulcers, lichen planus, chronic lesions, acute lesions, as well as salivary gland disorders, and then pain, orofacial pain, not the dental pain that you have when you have a toothache. We don't really focus much on that, but on pain that comes with, neuropathic pain, like neuralgic pain, or like, trigeminal neuropathic pain. And we also a field of oral medicine is also treating patients that have medically compromised conditions. That means some oral medicine specialists focus on providing dental treatments to patients that would typically be seen in a hospital setting because they have compromised health. So that is oral medicine. So evaluation of patients with medically related conditions, as well as providing dental treatments to patients that are medically compromised. Yeah.
Okay, let's take that for a minute. Okay, so these are not necessarily, these are issues that maybe arise from, like you said, a medical issue, and they're complications, they're oral complications of a medical issue, correct?
Yes.
Got it. Okay, okay.
So whether it's somebody that has oral manifestations of a systemic condition, for example, there are hosts of systemic conditions that can have oral manifestations, or whether it's someone that has a lesion in the mouth that is primarily just in the mouth, localized in the mouth, or
Okay,
someone that is having pain that is localized to the oral and maxillofacial region, or pain that is presenting in the oral and maxillofacial region as a continuum of an underlying systemic condition. Essentially, we bridge the gap. We bridge the gap between medicine and dentistry.
got it, got it. Oral and maxillofacial region is what? The mouth
All
and
of
the.
my facial region means the mouth,
Mhm.
everything inside the mouth, but it
Okay,
also includes the joints, it also includes the neck, it also includes, the structures attached to it and the effects of systemic health on these structures. So
got
we're
it.
not just we don't cut off the head and treat only the head. When you present to an oral medicine specialist, we take the full body history. It's like seeing a regular physician. We take full body history. We do review
Mhm.
of systems. We look at the whole. We look at labs. We look at medications. We think about. We ask questions about everything so that we can correlate the patient's symptoms with their overall health.
Got
Yeah.
it.
And then
Okay,
we collaborate, of course, with other medical providers depending on what the patient presents with.
got it. Okay, thank you. Thank you for clarifying that piece. Okay, how about the TM?
The orofacial pain.
Yes, the orofacial tone. Yes.
So orofacial pain is also a specialty in
Yeah.
dentistry. Orofacial pain. So oral medicine is wider. So oral
Mhm.
medicine, like I said, medically related conditions affecting the oral and maxillofacial region, including lesions, salivary gland disorders, treatment of patients with dental treatment for patients with compromised conditions, and orofacial pain. That's
Mhm.
oral medicine is broad.
Okay.
Orofacial
Okay.
pain is deep.
Okay.
Orofacial pain is a deep dive into pain. That
Yeah.
means that they are very focused on pain. They treat headache disorders. They
Mhm.
treat, any pain, head
Mhm.
and neck, trigeminal neuralgia, neuropathic pain, cervicalgia, that's neck pain, and sleep disorders. You know.
Mhm.
So that's orofacial pain. Is deeper with respect to pain management. Oral
Mhm.
medicine has a broader um,
Mhm.
distribution. Yeah.
All right. So now let's then go to TMD, or temporal mandibular dysfunction. Can you just shed some light on that phenomenon? Because I love, this is where not only do we have that intersection just personally as friends, but even in terms of patients, right?
Mhm.
Because one thing I hear, especially with women, when they come to see me, is, and I learned to say this, I'm like, TMJ, TMJ, my TMJ, my TMJ. I was told I have TMJ. Yes, we all have TMJ. So help, first of all, clarify that. And
Okay.
it impacts sleep a whole lot. In fact, many of these patients end up needing sleep studies, at least when they come to see me, because there are concerns that they might have sleep apnea or maybe some kind of chronic stress that's making it hard for them to sleep. So we're treating insomnia. There's a whole lot going on with that. So maybe help just shed some light around that.
So, like you mentioned, when when I teach students, I usually will start with, let's kind of like get a terminology right. So, TMJ is acronym for temporomandibular joints. So,
Mhm.
everyone has two joints, but TMD, or you can say temporomandibular joint disorder. TMD is temporomandibular disorders. So the joints, of course, is made up of the mandibular condyle that fits into the fossa of the glenoid fossa on the skull, and then you have like a disc in between. So the temporomandibular disorders is a broad name. It's not a direct diagnosis. When you say someone has TMD, it's not a direct diagnosis. It's an umbrella term for a host of conditions under that umbrella term affecting the temporomandibular joint and its associated structures. So
Mhm.
you can use TMD and still have a number of disorders under that will be for muscle related conditions. And there
Mhm.
are a couple of conditions that are under muscles as for that category. There are a couple of conditions under disc disorders
Mhm.
because, like I said, you have the disc that is separating the condyle from the glenoid fossa of the skull. So you have disc disorders, and you can also have degenerative conditions. That means like arthritic conditions affecting the joint structure itself.
Mhm.
So there are a host of different disorders under that umbrella name temporomandibular disorders, and of course you can have
Mhm.
headaches secondary to temporomandibular disorders as well.
Mhm. 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 And do you notice that some of this, because another thing that a lot of people present or come in with is teeth grinding. Does that seem to play a role in them developing, or is it a result of them having this TMDs?
Okay, so bruxism can be one. So TMD is multifactorial. There isn't one single reason why people may present with TMD.
Mm-hmm.
Again, talking about the umbrella term, not necessarily a specific diagnosis.
Yeah.
There isn't one specific reason. There are a host of reasons why one person can end up having a temporomandibular disorder.
Mm-hmm.
Bruxism is one of the things that you consider, but you also have to know that it is one of the things that you can consider as a potential cause for temporomandibular disorder. There are lots of bruxers out there without TMD.
Okay.
Yeah, so
Got
it
it.
is a potential um, cause for TMDs in susceptible patients. But again, it is not a one-shot deal because there are people that have, you look at their face, their masseter are like
What's master? Remember, we're not doctors watching all doctors.
so
Yes.
if you touch the sides of your face and you clench, you can
Mm-hmm.
feel the bulge at the
Mm-hmm.
sides. Those are your masseter muscles.
Mm-hmm.
So you notice that some people have really strong masseter muscles that look as if that they're
They've been working out. They've been to the gym.
they've been lifting weights all their life and they don't have any pain. So
Oh
TMD
wow.
is multifactorial. So
Okay.
bruxism is one of the potential causes in a susceptible patient. Yes.
Hmm. So to help, and I think we're gonna sit around here for a bit. What are, and I don't know if this is also something that you address in your practice, but what causes, apart from stress, what else are other causes of bruxism, which is teeth grinding?
So bruxism is now kind of like classified as a sleep related disorder essentially. So what are the other causes? It could be stress. It could be
Mm-hmm.
genetic. It could
Mm-hmm.
be that it's idiopathic. It could be a medication.
Mm-hmm.
Do you understand? And sometimes it's just idiopathic. We don't know why
We don't know
some
what.
people are bruxers, but
Yeah.
when people are stressed up, they are more likely to brux. Some medications like SSRIs are more likely to lead to cause susceptible people to brux.
Have more bruxism.
And
Okay.
sorry,
No, no, to have more bruxism, the
yes.
medication. Okay.
And then poor sleep quality.
Mm-hmm.
They've Some people have said other sleep related disorders like sleep apnea might be a contributor to it. But
Yeah.
sometimes it's idiopathic, we just don't know. So
Yeah.
you want to kind of like look for the reason, try to look at the medications, look
Mm-hmm.
for other possible potential causes for each patient. Yeah.
Mm-hmm. And that's helpful. So I think it's important that what you highlighted, because here's the thing, there's a lot of conflicting research about teeth grinding or bruxism and sleep apnea. If you have bruxism, that means you probably have sleep apnea. It's not always the case because a lot of these folks come to see me and we do sleep studies, and sometimes their sleep studies don't necessarily show sleep
Mhm.
apnea. But then, like you said, they may have a lot of stress, underlying stress, anxiety, and things like that. So I think it's important that we look at the whole picture, the
Mhm.
whole picture, like what is playing a role that's making this manifesting in, in that oral cavity in that sense. So I think this would make a good segue to lifestyle medicine, how you decided to sort of feed in lifestyle medicine to all these things you're doing. So why is that important? Like how does entire sort of, how does oral medicine and lifestyle medicine, how do they intersect?
So, our medicine or facial pain intersects with lifestyle medicine definitely, but
Mm-hmm.
I chose to get certified first of all for my own health. I have a
Mm-hmm.
friend who is board certified, an MD who is board certified in in lifestyle medicine, and around that pandemic time when we had extra time, she was talking to me a lot about the positive effects of lifestyle change for my own health because she knew some of my health conditions. So I kind of like decided to do it first of all to learn more about it so that I could get healthier myself, and then by extension kind of like use what I learned for my patients.
Okay.
So in the context of treating patients with like orofacial pain and as well as patients with lesions, I offer tips for lifestyle to them because you find that chronic pain in itself can induce anxiety and depression. So if somebody has been in pain for a long time, that is one of the triggers for getting anxiety and depression, which ends up going in a circle because anxiety depression will make the pain worse. So
Mm-hmm.
sometimes anxiety depression can be one of the um, factors that could initiate the pain, one of the many factors for the patient that could initiate the pain. But on the other hand, whether they got the anxiety depression before, whether it's the pain causing the anxiety depression, having anxiety depression, especially when it's chronic and when it's sustained, affecting sleep, affecting mood, affecting the quality of life, tends to end up depressing the whole immunity and making the patients more susceptible to pain because it kind of like will end up ramping up the sympathetic nervous system. So I talk to patients about the effects of restorative sleep on their pain. And I always, I say sleep is medicine, making sure that you have enough time in bed to sleep because you need to restore yourself, even though it may be difficult. We talk about regular sleep hygiene practices with the patients. So we talk about effects of stress on how stress can, upregulate the nervous system and make them more susceptible to pain. We talk about different things that they can implement, to help to reduce stress in their life. And I always joke with patients, like I joke and I'll be like, I wish we could all discover the magic pill for stress. We'll all take it. But, stress is not something we can eliminate, but this is the effect it can have on your pain. So it's important to be aware of it. And then we discuss that. I talk about social connections. So sometimes, for patients, I use myself as an example. I'll be like, for me, these are the things I like to do. I like to go for nature walks. It really helps to calm me down. I like to listen to meditative, music, and I like to journal, write down the things that I'm thankful for. I try to get in bed. So I use myself as an example sometimes, and I give them tips on how to like reduce their stress and to make sure that they get into bed and are aware of the fact that if they don't, then the nervous system, essentially the brain, gets involved in the pain pathways, and that kind of like helps to amplify and sustain their pain. So I talk about physical activity, but not, as much as I talk about the stress, the sleep, and the social connections. And then I
Mm-hmm.
talk about for patients, depending on what the patients coming with. Some patients are coming with lesions. I do talk about nutrition with them, just to make sure that they are getting the right nutrition. Especially patients are coming like with chronic lesions. And then, of course, for every patient, you want to make sure that you address things like tobacco and smoking. So, lifestyle medicine has a strong effect on a lot of things, including the patients that I see as an oral medicine or official pain specialists. I think we
Mhm.
can all educate our patients better. Sometimes we may not have all the time. I mean, nobody has all the time to sit down to, you know, give a whole talk, but as much as possible, trying to put it in here and there for each patient so that they understand the effects. Yeah.
Wow, thank you so much for, and I think it just makes a lot of sense, right? We know that when you're in pain, your threshold, meaning that your ability to when you don't sleep well, your ability to tolerate pain is less.
Hmm.
It just is. And so it sounds like this is not just from an emotional standpoint. This is more from also, that sympathetic fight flight mode standpoint as well. So there's so many reasons why sleep becomes almost a pathway to healing if
Hmm.
you're having issues with orofacial pain or any type of pain. I mean, I see this also in a lot of people with conditions like fibromyalgia,
Hmm.
arthritis. They are already exhausted from dealing with so much pain. Their mood is low. They may feel anxious. They may feel depressed. And they may just lay in bed all the time or just try to numb the pain by, scrolling on social media, watching TV, drinking alcohol, things like that. So it ends up causing poor quality sleep, which then worsens the pain and it becomes this vicious cycle. And so
Hmm.
it's really helpful to see that this becomes a big foundation when it comes to the kind of advice that you provide.
Yeah, and of course, depending on what the patient comes in with, I focus on that lifestyle um,
Mhm.
instructions. Like for TMG, we talk about posture,
Mm.
economics, neck posture, jaw posture. You don't want to keep your teeth together all the time. Your teeth shouldn't be together all the time. There should always be like a sliver of space between your top and your bottom teeth.
Oh, really? I didn't know that.
Now you know. Because if you have your teeth together all the time, you're lifting weights with your masseter. So
But
you're
how do you
actually activating your muscles.
So how do you I think this will be very helpful again because I have a lot of patients, lot of women stressed, anxious, not sleeping well, and they have TMD.
So
So
very simple. Just I tell them you have to separate your top and your bottom teeth all the time. Sliver of space. That means there should be you shouldn't hang your mouth wide open like that's necessary.
yeah.
Sliver of space in your top and your bottom teeth, and
Mm-hmm.
your jaw rested like your jaw should hang like a hammock.
Mm.
Tongue position, most people find that their physiological normal resting position for their tongue is
Mm-hmm.
on the top front roof of the mouth. So if you say
Mm-hmm.
Nancy, the tip of your tongue hits the top front roof of your mouth when you say
Mm-hmm.
Nancy. So rest your tongue there, but don't push it because the tongue is a muscle. If you push it, you're also activating muscles. So
Mm-hmm.
teeth apart, tongue up, and then the lips gently sealed. So teeth
Mm-hmm.
apart, tongue up, lips gently sealed, and your jaw should hang like a hammock. It shouldn't be like stressed. Like
Yeah.
I said, if you clench your jaw and you feel the size of your face, you'll feel your masseters clenched. So if you
Mm-hmm.
have your teeth tight all the time, you are activating your masseter muscles and you're putting weight on your joints. So
Mm.
I also tell them that this might not be something that they're going to remember if they're not used to it. So we
Yeah.
use tips to remind for them to remind themselves subconsciously. So I will be like, you can put random reminders on your phone at
Mm.
multiple times in the day just to ding until you get used to it. Or if you have a specific place that you work, you can put like sticky notes around the place, with reminders just till you get used to it. So we talk about different things, regarding TMD, lots of, TMD home care
Mm-hmm.
instructions as well. Yeah.
Mm-hmm. And so, in addition to, again, managing, trying to figure out, the lifestyle piece, the posture, what other, because sometimes I hear about, oral surgeons suddenly coming into the picture and all kinds of things are going on. So, like, what does that look like? What does treatment look like
So
for someone suffering with TMD?
so there's a joke someone has that TMD, another, like TMD, I says means temporomandibular disorders, but
Yeah.
TMD also means too many disagreements. That
I thought
means
you were going to say too many doctors because it seems like so many people end up coming into the
precisely that one, and too many disagreements on how to treat. So
Mm,
oral medicine, American Academy of Oral Medicine and American
mhm,
Academy of Orofacial Pain, those are the organizations I align with.
mhm,
We believe that unless the evidence is really strong, initial management of temporomandibular disorders should be conservative.
mm. Okay.
So we believe on the full assessment of the patient. That means
Mhm,
again, you don't cut off the patient's head. The patient's head goes along with the rest of the body. So you're going to do a full body history for each patient and assess the, what factors apply to this specific patient and how are you going to address it from the
mhm,
self-care, from the instructions you give to the patient, um, medications,
mm.
physical therapy, trigger point injections. Those are
Mhm.
possible. So, like I said, remember I said TMD is an umbrella term. There are
Yeah,
different diagnoses under that.
depending on what.
Every
Okay.
patient is different, and
Yeah.
um, you have to figure out: is it primarily muscle pain? Is it
Mm,
primarily joint pain? Is it the disc? Is it the joints? Before
mm.
that kind of like helps you tailor your management.
Okay.
So if we kind of like are not quick to use irreversible measures
Mm.
for the
Okay.
management of TMD. So initial management, unless the evidence is profound, should be conservative. That
Mm.
means lots of patient instructions, lots of lifestyle, instructions,
Got it.
physical therapy, trigger point injections. We do use Botox.
Mm-hmm.
And
Yeah.
when you talk about surgery, so surgery is usually reserved for patients that continue to have pain and have failed conservative therapy. Again, unless there's evidence staring at you. There are some
Yeah.
patients, there are a few patients at first visit I've sent them to surgery. So it's not as if nobody ever goes to surgery. Of course, people go to surgery, but you have
Mm.
to evaluate the patient. So if the evidence is there staring at you from day one, then you send them to
Yeah.
surgery if they
Mm-hmm.
need to go to surgery. But otherwise, we start with conservative measures. Surgery usually could be for disc displacement disorders. A lot of times they do arthrosynthesis where they go in and that's the surgeon, I'm not a surgeon, where they go in and they flush out the joint and do like some minor repair inside the joint, and
Mm-hmm.
then very minor amount of patients will get a total joint replacement. That's you know very rare, but yes, some people do get total joint replacements, but that's like
Mm. Wow.
out of
Way.
yeah.
And I see Dr. Valerie, who's also a phenomenal dentist here, laughing at what you said. Too many disagreements and too many doctors for TMD. So, um, definitely, I'm sure you can relate, Dr. Valerie. Well, this has been really informative for me. I'm taking away so many pieces, and that is the fact that the body is one. And so you might have something going on with your mouth, and it ends up being that every other aspect of your life needs to be, in terms of your lifestyle, needs to be addressed as well. And so really taking care of the entire being. And I also love the fact that you talked about these lifestyle factors and more conservative means first, prioritizing your sleep, managing stress, physical therapy, diet, exercise, social connections, all those things as really first line. And then, of course, trying to address the root cause. And of course, one of the root causes I've seen also, while I do tend to see those who have this pain and are sent to me, and we do sleep studies, and they're normal. I've also seen those who, on the
Mhm.
flip side, have abnormal sleep studies. So treating sleep apnea, don't just assume, because the thing about if you have sleep apnea on top of all this, any type of pain, is that even if you stay in bed for 9 hours, it is 9 hours of crappy sleep. If you
Mhm.
have sleep apnea where your brain is being deprived of oxygen every few minutes through the night. So then you still have the pain, you still feel uncomfortable, you'll still feel unwell. So I think that is just an important piece that is, needs to be addressed. And I love that your principles, your values, and your approach to care is so well aligned with what we do here as well at the Restful Sleep Place. So, so good talking with you. I told you she's the expert. She's a triple expert. So thank you so much. We've learned so much. So how can people find you?
So you can, my website is called oralmedicinesspecialist.com. You can find me there, and you can find me on LinkedIn, Chizobam Idahosa. That's my name. You can find me there. And I'm on Facebook too, as Dr. Chizobam Idahosa. And on IG, the only the only page I use is Beautiful in Jesus. That's because I'm also a Christian minister. I write Christian devotionals and articles. So if you want to connect with me on IG, you can follow me on Beautiful in Jesus, and you can sign up to receive my weekly Christian devotionals. I'll love that.
That's been such a blessing too. So much. She has so much value within this oral medicine space, but also so much value when it comes to growth, spiritual growth. And thank you so, so much, Dr. Idahosa, my dear friend. Thank you for taking time out of your very busy day to put this hat of expert on. And if you're out there, we've talked a lot about pain, right? Oral facial pain, but any type of pain. Or you don't have pain, but you just really have sleep struggles. We're here to help. So if you're having a hard time sleeping, whether it's poor sleep quality or you do have the sleep opportunity and you're just really having a hard time shutting your mind down, I talk a lot about that. And I actually put a post out today where I talked about the fact that we optimize our external environment, but the internal environment with a busy, busy mind can also get in our way of sleep. So if you're looking for help to get that restorative sleep that you need so that you can be the best version of yourself, then you can check us out at therestfulsleepplace.com. We'll be more than happy to see you. If you're residing in Pennsylvania, New Jersey, or California, if you don't, we could still help you. You could grab a copy of my book. It's Beyond Tired. Can you see right there? A great, great resource, really around kids' sleep, but there's also content in there that can help the entire family. All right, everyone. Thank you so much. Thank you again, Dr. Idahosa. It was so good
You're
seeing you and
welcome.
speaking with you.
Thanks.
All right. All right, everyone. Have a good night and rest well.
Bye.